Hi everyone, it's Tara Bianca with Be Light Transformative Therapy. And today I want to pick up where we left off last week and bring you part 2 of our Breathing for Low Back Pain series. Remember that these strategies might be helpful for acute low back pain, but also digestive discomfort and potentially menstrual cramps as well. And then one quick thing before we jump in. You guys know that I'm trying to get to 20,000 subscribers by my birthday, which is this Friday, June 24th. And so, truth be told, I'm recording this video ahead of time, so I'm not even really sure where the numbers stand in this moment. But I do know that every little bit helps. So if you or someone you know gets a lot of value out of my videos, then please go ahead and hit that subscribe button. Thank you so much. For part 2 of this series, we're going to investigate some strategies in a supine position, meaning lying down on our backs. So go ahead and get comfy, find a comfortable position, and let's jump in. Okay, so you found your comfortable supine position lying on your back, and I always recommend either actively bending your knees and planting your feet into that surface beneath you, or getting a bunch of pillows and kind of stacking them under the knees so that you can really let the hips relax and really let the legs go. Why is this important? Because when we get the hips flexed like this, it really helps to slacken the abdominal wall. It really helps to relax the lumbar spine. And so it makes it easier to breathe into the abdomen. It makes it easier to activate the diaphragm more completely. So this is a really nice position to breathe in, and it's also really helpful for low back pain and digestive issues. I forgot to mention it in part 1 verbally, but I did include a link to the video I made a few months ago on diaphragmatic mobilization. And I'm going to mention it again today because whenever we can really work on the diaphragm, it always helps to relieve low back pain and digestive issues. So that's how we're going to begin our session today in this supine position. We're going to actively go into our diaphragm on the right side. We're going to actively go in on the left side. And then we're going to hit a bunch of points along the abdomen and along the pubic symphysis to try to start to release this area. And again, bring gentle body awareness and breath awareness to these spaces that don't really get a lot of action during the day, right? We forget to breathe low. We forget to breathe deep. So everything that we do today is to encourage the breath to come deeper and to invite gentle movement into these areas of discomfort. So we're going to start by going under the right side of the rib cage. So we've done work like this before in the diaphragm mobilization video. Today we're going to keep it very basic, very simple. You're just going to find the outline of the right ribs. This is not my right, this is my left. I always have a 50-50 shot and I almost always get it wrong. So we're outlining the left ribs. It really doesn't matter which side you do first. And we're just going to take our fingertips. So ideally you don't have nails. If you have a little bit of nail there, you can grab some tissues or a towel or a t-shirt or even put a t-shirt on, and that should buffer it enough that you can get under without hurting yourself. And on my exhale, I'm just going to sink towards the mat and then up under the ribs. And again, it's gentle. This is not the hardest work you've ever done in your life. This is not the most pressure you've ever applied in your life. Gentle, easy, just sinking with your breath, relaxing the rest of the body, shoulders down away from the ears. So there's a couple ways we can grip the ribs. You can see that my left hand is kind of grabbing like a coffee mug or something, right? It's really wrapping around the rib cage, whereas the right hand is kind of coming in with direct fingertip pressure. So I'm using both of them equally, going in on my exhale. And now whenever I do a little posterior pelvic tilt with my pelvis, it just again hollows out the abdomen more. It allows me to sink a little bit more deeply and a little bit more easily. And so just getting a nice, good, firm grip underneath the ribs. And so now we're just going to hold it, and we're going to take 2 breaths just with our fingers under the left rib cage. Here we go. In and out through the nose, gently, quietly, easily, slowing down the breath, trying to extend the exhale. Tongue on the roof of the mouth, right behind the top teeth, without actually touching the teeth. And breathing in. And out. And in. And out. Good. I'm going to stay there for a minute. When in doubt, I always shoot for that 4-6 cadence that we practice so often, that 4 counts to breathe in, 6 counts to exhale out. It's nice when we're doing this work to work on elongating the exhale, remembering that more so activates that parasympathetic response in our body and is more likely to help us get out of that pain cycle that we're stuck in, okay? The other thing I want to say is as you inhale, my fingers are applying pressure. Don't let up with the inhale, right? Your fingers are applying that pressure and offering resistance on the inhale. So don't come out on the inhale. Keep providing resistance even as you inhale, and then as you exhale, sink a little bit more. Okay, let's try it on the other side, on the right side. So same thing. I'm going to take my right hand now and I'm going to grab the rib cage, right? I'm going to hook all my fingers around that rib cage and get a good grip. And then the left fingertips are going to come in for added support, added pressure, and just go in with more fingertip pressure. So it looks like that, kind of carving out the ribs, right? So find a grip that's comfortable for you. I'm going to sink on my exhale. So I'm taking a little inhale and I'm exhaling out. I'm sinking under. Whenever I do a little bit of a posterior pelvic tilt, it just helps me to get in there. It slackens all that abdominal tissue so I can sink more readily. And now I'm in, and I'm going to just hold. Regardless of what my breath is doing, I'm not going to let up with my finger pressure. So I'm holding. Again, not so hard that you hurt yourself. Find a comfortable position and a depth that is tolerable for you. I can sink pretty easily under my rib cage. Not everyone's going to be able to do that. Even just a little bit of pressure in the direction of intending to touch your diaphragm is going to make a difference. So here we go. Keeping this grip, keeping this pressure, taking 2 breaths, gently, quietly, easily, in and out through the nose, slightly elongating the exhale, breathing at a 4-6 cadence if you like. And out. Sinking more on your exhale. And in. And out. Sinking more. Good. Great job. Okay, let's keep moving around because we could be here forever, but it really starts to relax the body, relax the nervous system, encourage a sense of safety, encourage a sense of inner peace. I feel all the organs relaxing. I feel my low back relaxing. So after each point that we do, just do a quick check-in with yourself to see, what is shifting? What is changing? Are there improvements in my symptoms? Okay? So now we're going to attack is the wrong word. We're going to address the waist crease, okay? So this will be the same thing that we did in part 1 of this series, where we were putting our thumbs into QL and then really carving out the waist and then coming into the inside of the ilia, right? Inside those hip points. So let's start that same way. We're going to take our thumbs and you're going to come to so I don't know if you can see me. I'm towards the back of the body. I'm in the waist crease, but I'm sinking until I feel that really vertically oriented muscle that I run into. So I'm sinking into that soft tissue. And now as I sink towards my spine, I feel like I run into a wall. That's your QL. So you're going to find that on both sides. That's what it looks like right in there. So it's a couple inches to the side of the spine. And now I've got my thumbs in either of my QLs. If you side bend, if you hike your hip on each side, you can feel that QL activate. It feels like it's trying to push your thumb out. So that's how you really know that you're on it. So it's really the posterior part of the body, right? So now we're just going to press both thumbs in towards midline simultaneously. I'm giving some pressure. I'm giving some feedback to my brain to say, brain, breathe here. I'm trying to increase the awareness in the posterior part of my body, in the back of my body. We tend to forget the back of the body even exists, right? We definitely don't think to breathe there. So today our goal is to bring more breath to the back of the body. So now holding those two QLs, pinning them with your thumbs, I'm putting a good amount of pressure toward midline. Let's take 2 breaths, same as we did before. Here we go. And exhaling out. Really allowing that belly to relax and expand on the inhale. Keeping that inward pressure with the thumbs and then exhaling out. Allowing that belly to deflate towards the earth. Good. So now let's come more into the waist crease itself. So this position when I'm in supine is a little uncomfortable for me. I'm going to go for thumbs again. So now instead of being in the posterior aspect of the body, I'm going to go right on that mid-seam of the body, right above the hip bone. So here's my hip bone. Here's my ribs. I'm between those two and I'm just pressing into that side seam of the torso. Again, I'm pressing directly in towards my belly button with both thumbs. And again, we're just going to hold there, pin the tissue, really with some firm pressure, bringing awareness to this area that we don't think about during the day where we're not breathing, and we're going to bring our breath there. So here we go, 2 breaths. Slowly, gently, easily, letting the belly rise as you inhale. And letting everything relax as you exhale. Keep that inward pressure with the thumbs. Keep pushing towards midline, pushing towards the belly button. Beautiful. Shoulders down away from the ears. Relaxing the upper body, not breathing so much into the chest. Thinking about deepening the breath. Here we go again. Breathing in. Breathing out. Keep sinking with the thumbs so you can sink more as you exhale. Wow, I'm feeling a huge change in my digestion. So check in with yourself again. Notice what you're feeling as things start to evolve and change during this session. Okay, so now we're going to take that point right inside of the hip points, right? So your 2 ASIS, those 2 bony prominences that stick out the front, right? Those hip points, we usually call them. You're going to fall right inside of them. So here's my hip point. I'm going a little bit medial to it, and I'm just falling off the bone into the soft flesh. Again, when I tuck my pelvis a little, when I go into a little bit of a posterior pelvic tilt, it just helps me to sink a little bit, get my fingers in a comfortable position, and then I can relax. Yeah, so find your position and then relax everything. And all I'm doing is keeping some firm finger pressure toward the earth and a little bit out towards the hip bone itself. So almost like I'm spreading the hip bones gently. They're not going anywhere, but I'm thinking about pressing down and pulling apart a little bit with firm finger pressure. Nothing painful. Stay close to the bone. Let's take 2 nice gentle breaths here. If you can, in for 4 and out for 6. Here we go. Breathing in. Keeping that firm finger pressure, trying to breathe into the fingers, but don't let the fingers move. Exhaling out, sink deeper. So as you breathe in, your belly is going to try to push your fingers out. Don't let it happen. Keep that firm finger pressure. Exhale out, sink deeper. Awesome. Good, we're going to take one more point, and then we're going to add in our belt technique that we also did in part 1. But I wanted to do the fingers first, and then for those of you who don't like to work with your hands so much, we have another option. So the last point I want to address is the space right over the pubic symphysis, right on top of the pubic bone. So if you start at your navel and I'm just taking my thumbs like this and kind of working your way down, you'll feel soft tissue, soft tissue, soft tissue, and then all of a sudden you run into the top of your pubic bone, right? There's nowhere to go. It's not soft anymore. You run into this hard bone. Okay, so that's exactly the spot that I want us to work on, but I'm not thinking about going with downward pressure towards my feet. I'm going to take my fingertips like this, and I'm going to press directly towards the floor. So I find my pubic bone. I'm sinking up just a little bit, falling off the bone and driving my pressure down and towards the earth. And again, a little bit of a posterior pelvic tilt to get in. And then once I'm comfortable with where my fingers are, relax the shoulders, relax the pelvis, relax everything. Good. And now let's take our 2 breaths, 4 counts in, 6 counts out. Here we go. Breathing in. Don't let your inhale push your fingers out. And exhaling, sink deeper. And another breath, breathing in. Keeping that firm finger pressure even though your belly is inflating. And then exhaling out, relaxing everything, sinking deeper. Great. Okay, so now just like we did in part 1, I'm going to introduce the belt or the strap or the resistance band, whatever you have available to you. So if you have a resistance band, which is naturally elastic, you can just tie that a little bit tighter than you think you want to around the waist, and you're going to use that to give yourself feedback to breathe into. This is just a belt from my bathrobe that I'm using because I don't have a good resistance band for this exercise available. You could also use a yoga strap, would be perfect for this if you have a yoga strap at home. So I'm taking it and I'm getting a good grip on this belt. Yeah, I'm going to keep elbows in, shoulders down. So now elbows are not going to go in actually because I can't maintain it at the moment. So you want to start by cinching the belt pretty tight, tighter than you think you want. And remember, as I breathe in, I'm going to let the breath win. And then as I breathe out, I'm going to let the belt win, right? So as I breathe in, I'm not totally giving up my pressure. I'm keeping some resistance, but I let the belly win. And then as I exhale out, I let the belt win and I really cinch my waist, okay? So we're using this to give extra feedback 360 degrees around that waist, right? So we really can feel, I am breathing into the front of the abdomen, I'm breathing into the sides of the abdomen, I'm breathing into the back as well, right? I'm breathing into my spine. I'm breathing into this posterior chain of the body where I always forget to breathe. So this is really helpful to have that 360 degrees of awareness around the waist. So here we go. Let's take a few extra breaths here. Let's do 3 like this. So cinching your belt, whatever you have. And here we go. Breathing in through the nose. Let the belly win. Feel how you're expanding into your back at the same time. So it's not just rising towards the ceiling, you're also expanding in towards the earth at the same time. And then exhaling out, let the belt win, really cinching the waist, 360 degrees. Let's do 2 more breaths like that. Breathing in. Expanding 360 degrees.
And then breathing out. Let the belt win, really cinching the waist. So I'm really pulling with my arms. I'm using a bit of force actually, keeping the shoulders down, but I'm really pulling. One more time, breathing in. Feeling yourself breathing into your back. So the belly is not just rising towards the ceiling, you feel your back expanding. And then exhaling out, cinching the waist. Great. So the advantage to having a resistance band as opposed to something that doesn't have elastic material in it is that you don't have to use your arms so much and create more tension in the body. So it's really nice if you have something that you can tie here and then breathe into 360 degrees and release. Okay, let's do one more spot with this belt or resistance band or whatever you have. Same as we did in part 1, just lowering it down. So in the back, I feel it coming around my sacrum. So I feel contact with that triangular bone at the base of my spine. And then here are my ASIS, my hip points. I'm bringing it right beneath those, right? I'm bringing it right beneath those hip points, and I'm really thinking about cinching my pelvis. So because we're really trying to compress bone here and it's a losing battle, we have to pull a little harder than we think, but I promise you, you're still going to feel it. And you're really going to feel it in the rectus abdominis attachments, these lower attachments down by the pubic bone. As you breathe in, you'll still feel that good amount of expansion. And as you breathe out, you just pull as hard as you can. And I promise you, you're going to feel a nice release in your low back and your pelvis. So I'm giving a good amount of pressure here. Let's take 3 breaths again. As you breathe in, you let the breath win. And then as you exhale, you pull a little bit more. It's not going to move as much. It's not like working on the soft tissue of the waist, but the intention is there. And as you breathe in, you let the belly win, and as you exhale, pulling. One more time as you breathe in. You let the belly win, and as you breathe out, really pulling. Good. And now just taking a moment here and just let your breath regulate to whatever it wants to do. Take a couple just normal breaths and just feel, is the breath moving through your body differently? Do you feel different in your physiology? Does your experience of pain or stress in this moment feel different than when we first began our session today? What has shifted? What has changed? Always taking notes so that you know if these exercises are actually valuable tools for you to utilize in your own practice. Good, so just taking a couple normal breaths, whatever that is for you. And just noticing, just feeling. For me, I feel my spine is much more relaxed. I feel my organs are much more relaxed. I feel my nervous system is really calm. I even feel like my voice deepened and lowered, like the muscles of my, in this pharyngeal space, right, have softened. The muscles of the throat have softened. So I feel really good. I feel much better than when we first lied down to do this today. And I hope you're doing the same.
That's it for today. I hope that these strategies in a supine position were helpful for you. If you got any relief from practicing these exercises today, or if you just have some feedback or questions for me, please feel free to leave any and all of those in the comments below. I'm going to release more of these breathing for low back pain videos over the next several weeks, so be sure to hit that notification bell and be sure to come check back soon. If you like this video, please give it a thumbs up and please subscribe to my channel. You know that I'm trying to hit 20,000 subscribers by my birthday on June 24th, so if you haven't already, it would mean the world to me if you could just hit that subscribe button. Thank you so much. Also, if you're looking for a more structured breath program, please be sure to check out my totally free Breath Basics 6-day challenge. And if you'd like more personal time with me behind the scenes, including monthly live Q&As and also monthly live guided breath sessions, then please consider joining my private online Be Light community. And lastly, if you'd like to further support the channel and the work that I do here, you may do so by either visiting my brand new Be Light store or by visiting my Buy Me a Coffee page. Thank you so much for watching, and I'll see you next time.